Good morning. As folks begin to file in here for the fifth and final webinar in the SCORP series, State Comprehensive Outdoor Recreational Plan. This session will focus on health and wellness, promoting healthy living through outdoor connections. We're very happy to welcome our DCNR speakers today, Cheri, Recreation and Conservation Advisor, and Ryan Dysinger, Assistant Director, Bureau of State Parks, as well as our guest presenter, Jason Lang, Director of East Goshen Township and Chair of PRPS Health and Wellness Committee. All right. And I know we're all pretty much familiar at this point in time with the Zoom environment, but I'll just take a few minutes to go through and familiarize everyone with the Zoom meeting toolbar if you are not familiar. Your audio and video have been turned off for this webinar. If you would like to toggle them on and off, you can do so here via the microphone and the video camera icons. If you click on this participants icon, you can bring up the participant window where you can see who's in the room. And this chat icon is how we will be handling questions today. So if you bring up your chat window, it will come up on the right-hand side of your screen. You can enter your questions into the chat at any point during the presentation, and we will be handling all questions at the end of the presentation today. If you want to shift between speaker and gallery view, there should be a little toggle switch up here in your right-hand corner. Mostly what you will see today is the presentation large in the main screen here, and then you'll see the little boxes for our speakers up here at the top. If you swap between speaker and gallery view, you will see only the speaker who is currently presenting. When you drop a question in the chat, you can either direct it directly to me, Carol Grayshaw, We Conserve PA, or you can direct it to all panelists. Either way, we'll capture it and we will handle everything at the end. Now, without further ado, I will hand the presentation back over to Cheri. Thank you, Cheri.
Hello, everyone, and welcome to the Statewide Outdoor Recreation Plan webinar. Many of you might be thinking, why does DCNR complete this plan so often? And the answer to that is so that Pennsylvania is eligible to receive grant funding from the Land and Water Conservation Fund. DCNR filters this funding to our local communities like you. There was a very large technical advisory committee that worked hard to create a vision for this new plan. That vision is enjoyable outdoor recreation, is welcoming to all, and accessible in every Pennsylvania community. We are covering the final priority, health and wellness, today. And in total, there are 20 recommendations and 70 action items within the 5 priorities that you have already listened to over the last several weeks. This is Pennsylvania's plan, and we are encouraging all outdoor recreation providers to read it and help us implement it. How can you access the plan? We have the plan available in digital format at DCNR's website under the Recreation heading at the top of the page. The website also contains all the public participation and supporting studies and research used throughout the plan. There's also an amazing story map when you go to the website or click on this link in the slide. It will be a great tool to use with your community settings. We are also mailing hard copies of the plan. If you would like one, please email Lori Ross to request one. These webinars are designed to learn about the plan findings, data, and our next 5-year priorities in easy segments. This is the final webinar. In case you have missed one or all of the others, we encourage you to watch the recorded version, which will be posted to the Recreation Plan website. Unlike the other priorities, this is the 3rd time health and wellness has been in the plan. We have been building upon a decade of relationship building and programming. As the Technical Advisory Committee was working through the health and wellness priority, we felt that there was still a lot of work to be done and the same challenges still exist. We are hoping to further our successes from the last 5 years by continuing to address the following challenges. Social, physical, and mental health being a priority in Pennsylvanians' everyday life. An increase in health data stating obesity and chronic diseases are on the rise. We also realize that there is a disconnect between people and nature. This topic has really been a focal point this year in our society with diversity, equity, and inclusion across all aspects in our community. And lastly, connecting healthcare and recreation providers. This became important for the next 5 years because we saw great work through the 3 prescription programs that began from an action in the last statewide plan. These programs really connect these two groups, and we thought that we really need those connections to get started in our suburban and rural communities to see a greater impact on chronic disease reduction. I included the 2019 data on obesity from the CDC website to compare with the prediction at the top of the slide. The New England Journal of Medicine has written that by 2030, the Pennsylvania population is predicted to be 50.2% obese. And they even went as far as stating 24.8% will be severely obese. Sometimes these predictions don't hit home, but when we put it into a different context, it starts to dawn on individuals that being overweight puts you at risk for developing many other serious health conditions, such as type 2 diabetes, high blood pressure, high cholesterol, which all of these can lead to heart disease and stroke. To address the challenges, DCNR is suggesting a holistic approach, one where we take the new research that draws the connections between green space, outdoor exercise, and improving our park access. Once these areas are established or improved, they will be there for the physical and mental health of our communities. We can't do all these things without the support of our local partners and the programs they offer, the experts in the fields of public health and planning, other state agencies, and most of all, the community members. We are hoping that the time allotment people had through the pandemic will open minds to help make it a priority and change that opinion from the spring lion poll in the purple circle. It states that aside from not having enough time, the top reason for preventing people from outdoor recreation is their health. The good news is that from the survey and polls completed, we found that Pennsylvanians agree that parks, trails, and open space are an essential part of the healthcare system, and respondents participate in outdoor recreation to improve their health. So we have a good starting point to implement our plan action items. I'm going to turn it over to Ryan now.
Good morning, everyone. I'm Ryan Dysinger, Assistant Director of Pennsylvania State Parks. I'm going to speak a little bit this morning on the first 2 recommendations of the health and wellness priority. So the first recommendation you can see on the screen there is educate on the connection between health and outdoor recreation. 2 of the action items for this section are working with our partners to develop framework to compile and promote resources describing the physical and mental health benefits of outdoor recreation, and to be able to distribute or share with Pennsylvanians. Another action is creating an interagency health-based team to coordinate relevant state grant programs and implement a program that recognizes communities for demonstrating the connection between health and outdoor recreation. For the last 4 years, DCNR's Bureau of State Parks, where I'm employed, has been working with the Pennsylvania Department of Health, specifically their Division of Cancer Prevention and Control, to effectively launch a pilot program to install sunscreen dispensers within select state parks. As DCNR promotes outdoor activity, we are aware that over 3,600 Pennsylvanians are diagnosed each year with skin cancer. And these dispensers prove invaluable to visitors to our lakes, beaches, and pools who may overlook sunscreen when packing for a day's outing. Under the program, each park was shipped a kit that includes 2 dispensers, the pole mounts, infographic signage, and 6 cases of SPF 30+ EcoSport sunscreen. There were also educational training sessions that were provided for staff at each location, provided in conjunction with the Department of Health and DCNR, and additional opportunities to promote this program on social media channels. All costs of the products are covered by the Department of Health's Cancer Prevention and Control funding, and both DCNR and the Department of Health are currently pursuing opportunities to partner with local health organizations and healthcare systems providers to cover costs in the future. The specific locations that were chosen to host these dispensers are within counties that have higher than average late-stage melanoma diagnosis. So feedback so far has been largely positive. Visitors like the idea of this service available to them should they happen to not pack their sunscreen with them. And I also think the bright colors, as you can see the dispenser photo there on the screen, kind of stick out in the natural environment and helped act as a reminder to people to take sun protection serious. DCNR has always worked to inform and educate outdoor enthusiasts on possible dangers, including water safety, hiking precautions, and maybe illnesses associated with ticks. So in 2017, when we began this program, we wanted to shed a very strong light on the sun. The sun's the #1 culprit in damaging our skin and causing skin cancer. We want to get the message to our visitors that sunscreen is important to help protect their families. Our expanded program has the potential to currently reach 800,000 Pennsylvanians. This is an incredibly important initiative that we're excited, and it's reaching more and more visitors every year. I did note on the last slide that all costs are covered by the Department of Health's Cancer Fund. Each park gets approximately $750 worth of equipment to participate. Currently, right now, 1 in 40 Pennsylvanians will be diagnosed with melanoma in their lifetime. And this was provided with no state tax dollars. The goal is to work with the local health partners, businesses, and such in the future to maybe potentially sponsor a specific unit at a location or help cover some of the replenishment costs of the sunscreen or additional dispensers in the future. That's something that I'd really like to focus on as we continue to expand and grow this program. We felt we would have the largest impact by focusing on our waterfront sites, whether it be beaches, swimming pools, things like that, as folks naturally have more exposure to the sun while they're partaking in waterfront activities. So 2021 will mark the 5th year of our program with the collaboration between DCNR, the Department of Health, and Impact Melanoma, which is a group that operates out of New England. That's where we actually procure the sunscreen dispensers and the equipment from, to continue to partner and distribute sunscreen dispensers through an assortment of state parks and recreation destinations. I will say this is a forged relationship that keeps getting bigger and better every year. Together, we're making a great impact within our state's borders and have successfully served potential sunscreen utilization to hundreds of thousands of residents and tourists alike within our state parks. So kind of a natural collaboration that went from that sunscreen program with the Department of Health is the Young Lungs at Play program. So in February of 2020, we began participation in a health department program titled Young Lungs at Play, which aims to eliminate children's exposure to secondhand smoke at, in our case, playgrounds. According to the U.S. Surgeon General, secondhand smoke exposure contributes to approximately 41,000 deaths among non-smoking adults and 400 deaths in infants each year. Secondhand smoke can cause strokes, lung cancer, and coronary heart disease in adults. Children who are exposed to secondhand smoke are at an increased risk for respiratory infections, middle ear disease, severe asthma, and slowed lung growth. DCNR has eliminated all forms of smoking and tobacco usage, including vaping, which is popular now, e-cigarettes, at all of our playgrounds within our state park system, which is approximately 130 state park playgrounds. I will mention, you see the sign on the right there, the yellow sign. In a related move, responding to not only visitor requests and support, in prior years, we implemented smoking controls. Currently, we're right now at 44 of our 54 state park beaches throughout the state. We have smoke-free beaches. So there's no smoking at beaches, and certainly smoking is not permitted currently within our state park swimming pool complexes. The Young Lungs at Play initiative is funded through the Department of Health and the American Lung Association. It complements the sunscreen program, which I had mentioned earlier, that we started back in 2017. It's directly in line with our park's mission of promoting healthy lifestyles. There's certainly a growing number of playgrounds, throughout, whether it's county parks, borough parks, township, municipal facilities that embrace the Young Lungs at Play program and now also forbid tobacco usage at their facilities. I just want to mention, I have 2 young children. I feel that our children should be guaranteed the right to play in clean air and healthy areas without having secondhand smoke around. Another topic that I wanted to mention is Lyme disease. So what's all the fuss about ticks? I'm sure most of you know that ticks are small arachnids that spread infections and disease. In fact, according to the CDC numbers, Pennsylvania actually has the most cases of tick-borne disease through 2004 through 2018. Ticks are extremely hard to kill. They're becoming more and more resistant to pesticides, and their populations seem to be exploding. While ticks are everywhere, their infections that they cause can be preventable. Pennsylvania Act 93, which was launched about 5 years ago through the legislature, is aimed to promote awareness, education, and prevention, as well as the surveillance of tick-borne diseases. Lyme disease is transmitted when an affected deer tick attaches itself to a human. Ticks are very slow feeders, thus infection only occurs usually within 2 or more days of attachment and feeding. Therefore, early detection and careful removal with a tick or tweezers can prevent infections. If you look in the upper right-hand corner of the slide there's tick removers that we use. We've distributed those to all of our employees within state parks, as well as having an extra supply of those in the office or usage areas within parks, so that if a visitor would come in and say, hey, I have a tick embedded in me, what's the best way to get it out? We can give them one of those tick removers to use. We'll mention that tick bites are DCNR's #1 claim of injury for our employees. So then naturally, with 39 million visitors to our state parks annually, we've been working to educate our visitors with a variety of tick-related messages that you can see there on the screen, from the Get Outdoors PA informational rack cards, which are on the left-hand corner of the slide, social media posts. That's a screenshot of the tips to prevent Lyme disease that we've shared on our Facebook and Twitter pages for state parks. Additional fact sheets, there's signage there, the white sign that we were able to get from the CDC that we post at trailheads and kiosks and things like that, just alerting the visitors about Lyme disease and ticks. And I did mention that providing the tick remover, should a visitor have a tick in them while in a state park, they could use one of those at our office. Moving on to recommendation 2, support programs that connect health and outdoor recreation. Some of the action items with this particular recommendation are fund community-based programs that advance health and wellness and connection with outdoor recreation programming. These opportunities will be through DCNR grant programs to assist development of outdoor spaces, as well as partnership grants to create new programs. The Department of Health, community foundations, and hospitals will also be a part of funding opportunities. We'll also conduct peer-to-peer exchanges among recreation and conservation providers to share best practices for connecting healthcare providers and outdoor recreation opportunities. This action item was started in the last plan and will further be developed over the next couple of years through our partners at PRPS, PEC, Clearwater Conservancy, our DCNR Conservation Landscape and Heritage Areas, as well as many others. So I'd now like to turn it back over to Cheri.
Thank you, Ryan. So recommendation 3 is equip healthcare providers with the tools needed to promote the health benefits of outdoor recreation. Under this recommendation, we want to define the benefits and best management practices of park and trail prescription programs and share with healthcare institutions to expand into new regions. We also want to create a statewide learning network to share research and best practices online and at health summits. DCNR has brought healthcare professional Dr. Michael Zook, the system-wide chair of Dysinger's Musculoskeletal Institute and professor of orthopedic surgery at the Dysinger Commonwealth School of Medicine. He co-wrote an article for the American Journal of Law Medicine while a White House fellow at the United States Department of the Interior. He researched and found that connecting exercise and the outdoors could make exercising more enjoyable for individuals, and that it would encourage people into physical activity and assist with the obesity crisis rather than redundant educational campaigns. He will be working on Walk with a Doc programs and presenting at conferences on the connection to health and the outdoors. Several strong partnerships have emerged across the Commonwealth connecting outdoor recreation with the healthcare community. In park prescription programs, doctors prescribe time outdoors for patients to improve both physical and mental health. Pennsylvania has seen 3 unique approaches to implementing park prescription programs across the Commonwealth. Centered Outdoors offers an incentive-based program partnered with local businesses and healthcare providers to offer prizes and special events for taking part in healthy activities outside. Pittsburgh Parks RX is a family-centered method connecting kids and families to their local parks through in-school and out-of-school activities and resource guides. Finally, Nature PHL offers a clinical model bringing outdoor play into the doctor's office, where healthcare providers share tools to connect families with local park resources. All of these programs encourage Pennsylvanians to be active and healthy outside and explore their local parks. The National Park Prescription Program website is listed at the top of the slide, as well as each program offered in Pennsylvania. Recommendation 4. Create walking and biking networks that provide safe, close-to-home access to recreation and encourage healthy behavior in communities. This is a rather large and involved recommendation within health and wellness and engages many state agencies as well as local municipalities, counties, metropolitan and rural planning organizations, and local transit authorities. At the same time Pennsylvania was updating its outdoor recreation plan, PennDOT was developing its first active transportation plan. Our plans coordinate and complement each other. We encourage you to check out the resources on PA WalkWorks page, which is on the left. There's an excellent webinar recorded back in March on PennDOT's new plan, Complete Streets and Stories from Communities that have been developing active transportation plans. WalkWorks is a walkable communities collaborative, which consists of 9 state and nonprofit agencies that meet regularly to increase walking and expand walkable communities across Pennsylvania. The Department of Health has funding available to develop active transportation plans and complete streets policies. In fact, they just announced grants to 10 communities this fall. Their next round will open in March of 2021. One of our actions is to close priority trail gaps to achieve the overall goal of having a trail within 10 minutes of every Pennsylvania. The trail plan recommendations and actions are posted on our rec plan page, and we expect to release the final plan in January. DCNR casted a vision of statewide trail network 5 years ago, and this plan reinforces the importance of this vision and updates our strategy to achieve it. With this slide, closing trail gaps has been a priority for a decade and still is. The easy trail miles are done. We have to focus our resources on priority places and close trail gaps on long distance trails we've been working on for 25+ years. This slide shows the online resource of open trail gaps and where we have closed trail gaps. We update this map every 2 years and will again in 2021. The way in which communities are designed to function can promote or inhibit physical activity for children and adults. Children's ability to be physically active in their community depends on whether the community is safe and walkable. Good sidewalks, reasonable distances between destinations, and access to structured play opportunities are all a few ways that can help improve the activity level of children on a regular basis. With this understanding in mind, we hope to encourage communities to complete an active transportation plan and eventually achieve a goal of having a park within a 10-minute walk of every Pennsylvanian. We have talked about our new access mapping in the Recreation for All and Technology webinars. This new mapping will be used to help create a Pennsylvania Safe Routes to Parks program to achieve a goal of having a park within a 10-minute walk of every Pennsylvanian. Or more importantly, who doesn't? We have just posted a new YouTube video to help users navigate the site and use it to its full potential. We encourage you to check it out and see the percentage of your residents that have access to outdoor recreation. For this plan, DCNR worked with the Trust for Public Land, first state in the nation to analyze how many residents have access to a local park within a 10-minute walk of their home. The places in red are highest need areas. Luzerne County Transportation Authority started a bus to park route a few years ago. The route runs from the city of Wilkes-Barre to Francis Slocum State Park during the summer. Watching the ridership increase on this route to the state park and seeing trailheads as they passed en route to the park gave them the idea to use GIS data to connect more than the state park to their transit stops. They decided to connect the local and county parks as well as their trails in their county. They produced this map and online information through a mini grant with DCNR and Pennsylvania Environmental Council. This is a great example of improving connections between mass transit and public outdoor recreation opportunities, which is our final action item. So in conclusion, how can you support the plan? You could create or improve a safer route to your park. You can start a Walk with a Doc program, become a Young Lungs at Play partner, start a sunscreen program, or install more shade structures within your park. Include a transit stop on your website to help riders know how to access your park. Create a loop trail within your park, or start a relationship with a local hospital. This concludes our explanation of the recommendations and action items within the health and wellness priority. I will turn it over to Jason Lang, East Goshen Township Recreation Director, to share how he is implementing these actions on a local level.
Well, thank you, Cheri, and good morning, everyone. Thanks for joining us this morning. So real quick, I just want to thank everyone involved with the SCORP. I know there are many hands that go into such a large and comprehensive document that shapes our strategic plan for the next 5 years. And I know it's been award-winning many times over in the past. I'm sure this iteration will be as well. And so for folks that don't know me, I'm the director for East Goshen Township, which is a small municipality, suburban community outside Philadelphia. And I'll talk about some of the examples of implementation for my community. But I also serve as the chair of the PRPS Health and Wellness Committee. And so I'd like to start with just a discussion a little bit of what this statewide committee, so for PRPS, for PRPS, I represent the 2,000 communities, local leaders who would be tasked with implementing many of the recommendations that are in the SCORP. So what is the Health and Wellness Committee? It's very simply a 9-person committee of local leaders like myself, representatives from DCNR, residents who are volunteers who care so much and passionately about their trails and parks, and also planners, of course. So what we do is we very simply advocate, provide, and promote health and wellness opportunities across the state. As an umbrella statement, we have always focused on the physical health of our residents, but as a committee, as the Health and Wellness Committee, we have really dived into creating a more holistic definition of health and wellness. That includes mental, social, and intellectual health and wellness opportunities and positive lifestyle choices as well. In terms of current initiatives, the initiative we're most proud of, which we'll roll out in 2021, is our Culture of Health program. We actually developed this in 2020 for rolling out, but because of the pandemic, chose to hold off for 1 year. But we do look forward to pushing this out in early 2021. And what it is, it's a turnkey program that local leaders in a childcare setting, after school time camp program, can deliver to their camp staff, to their out of school staff, and it really focuses on creating that culture of health. Activities and programs that not only develop a physical health for an individual, for a child, but really their intellectual health, social, and emotional health as well. And so it's a comprehensive program in which staff can be trained on how to implement it, the variety of activities that are included, and what are the goals of each of the activities. And so the staff can, on a Monday, Tuesday, or Wednesday, focus on emotional health one day, social health the next day, and really focus in on developing that holistic definition of health for the kids in the program. We look forward to, in a few years, with success with our key first demographic of children, of rolling it out for other target groups, such as seniors across the state. So look for that. It will be on their PRPS website. It'll be free and open for general public use at prps.org, and that should be posted sometime in the new year. Some future initiatives that we'll be working on in 2021 and beyond is we really want to forge that connection between healthcare networks and our local providers. I think we're really, when you look at the pandemic and you see the effects that it has potentially had on our residents, our parks have become so vital. They're really the only game in town right now, and they are providing those health and wellness benefits. And so we see that vital connection between the healthcare networks and our residents, and want our residents to value our outdoor spaces, our parks, our trails, our playgrounds as the key element in maintaining and improving their wellness. And so as a committee, as the Health and Wellness Committee, what the problem that we run into most of the time with talking to other folks like myself is local park and rec directors say, I simply have no time. I do all my own programming, I'm changing the garbage, I'm running programs. I don't have time to create one more program. So, and they don't know where to start. You know, they may call up their local health network and they don't know who to talk to, where to go, which doctor they should approach about creating a park prescription program. And so the next thing that we'll be working on as a committee is, alongside DCNR, is creating a park prescription toolkit, which will have resources from across the state. So whether you are in Pittsburgh, Philadelphia, up in the rural areas of north central Pennsylvania, you can turn to this toolkit and it will give you a roadmap of how to create that relationship, who you should call, contact information, so you can hit the ground running, make it a successful partnership. Education is key. Through PRPS, we educate our 2,000 members, and we all like to stay abreast of what's the latest and greatest of how we can forge new programs, activities, and innovations. And so at the next PRPS conference, which registration will open sometime in the new year, I encourage everyone to attend. It will be next March. We'll be presenting on three topics. The first will be a fun activity called 99 Seconds Go, in which leaders from across the state will be in a collaborative experience where they talk about their current health wellness initiatives and are sharing their positive experiences that other local practitioners can take back to their communities. Our next presentation will be a Park RX Roundtable, and this is where we bring in the healthcare network leaders, Dr. Justin Schreiber and Kathy Ramson, representing the east and the west of the state, and they talk about the park prescription programs from their perspective, from the healthcare perspective, to local park and rec leaders, and say how you can forge that relationship, what are the key indicators of success, and where you can go to find tools. And then the last one we'll be presenting on is SOPark, and this is the system for observing play and recreation in communities. This is a really neat, absolutely free, Apple-based data collection recreational tool. And very simply, utilizing this app, you can go into your parks and you can calculate user counts based off of health and wellness attributes. So for instance, you can calculate for sedentary, walking, or running. The really neat thing is that at the end of your reporting, you can calculate how much health and wellness benefit you are providing for your communities based off of your parks. So I actually use this here in East Goshen Township. And every year, I can tell my elected officials, our trails had 250,000 users for this calendar year, and it saved an approximate $1.8 million in healthcare savings. And so it ties a value to our park use, which is a really wonderful tool. And again, for everybody at home, it's 100% free, user friendly. So that'll be a great session that we do at the conference next year. I highly encourage everyone to attend. And so the last that I'd like to talk about is our own Paley Pike Trail. And so as Cheri mentioned before, we want people to be connected to their parks. We want everyone to be within a 10-minute walk of their parks. East Goshen Township, we're a fairly affluent community. We were built in the 60s and 70s, and this is when nobody wanted sidewalks. And so we have lovely houses that are close to parks, but everybody has to get in their car, turn the key, and drive maybe 3 minutes down the road to our parks. And so coupled with that fact is our community is 96% built out. So we really have no room to do too much. And so we found through our master planning of our parks, through our latest pros plan, comprehensive plans, that the number one thing that our residents want are trails. Trails, trails, trails. And you can see from the state park usage this year, trail access across the state and across the country. During the pandemic, the trails are where people go. Trails are where people go to exercise. It's where they go to socialize. They're socially equitable. Trails are so important in connecting and keeping our communities together, especially right now, but in the long term, it's our number one recreational asset. And so our leadership understood this and created the Paley Pike Trail. And so essentially this bisects our township. It connects our parks with our township building, our schools, the local YMCA complex, and it really will serve as the spine to connect then our feeder trails that go out into the neighborhoods. And so we're currently constructing the trail, and I know that we're all facing pulling up our tightening our belts in terms of economics, but there is significant grant money out there for trails right now. It's in the SCORP, obviously. Trails are number one across the country. All planners want trails. Our residents want trails. So I would say if you're a local park and rec leader right now, and you're on the fence about do we go forward with the trail or not, now is the time. Now is the time. Trails are always going to be used. They're great assets, and there's a lot of significant grant money out there to help you move your projects forward. So with that, we would like to open it up to any questions you might have.
So thank you very much to our speakers today. As we mentioned at the beginning of the presentation today, please feel free to drop your questions into the chat box at this time. I do have one question to get us started from an anonymous attendee. It is my understanding that the Park Prescription Program Nature PHL in Philadelphia has closed. Will DCNR be assisting in resurrecting this program? Actually, this is a two-part question. Will DCNR be assisting in resurrecting the program, and has DCNR funded any park prescription programs this year? Where, and if not, why?
Diane, are you able to hop on and help answer this question?
Hello, everyone. My name is Diane Krippus, also with the Bureau of Recreation and Conservation. And Nature PHL was a sad loss due to the pandemic, and so additional funding was needed, and then the pandemic hit, and we were so sorry to see the lack of funding support for the program. So we are open to having discussions with Philadelphia and Philadelphia leaders on trying to help resurrect it or transfer it to new leadership. We haven't had those discussions yet, but certainly see it as an important place to have that program. Philadelphia has the most challenging obesity statistics in the state of Pennsylvania. I think it's number one in our in obesity in our most obese county. So we're happy to have future discussions about that. I believe we did fund Centered Outdoors this past round. Our nature, our park prescription program in Philadelphia and Center County with the Clearwater Conservancy. They don't come in every year, but I'm pretty sure that we did provide additional funding to Centered Outdoors this past round of funding.
Great. Thank you for that, Diane. I have another question. How do we get involved with PRPS Health and Wellness Committee in order to share our experience and learn from our peers?
Oh, that's a great question. So, so there's really two things you can do. One is my information is here, so you can email me if you have specific questions or if you specifically want to get involved in an aspect of it. And then if you also go to the PRPS website, there are pull downs where you can find a lot of the resources or projects that we've worked on.
Great. And another question for Jason. How did you get neighbors next to planned trails to support the project?
I twisted a whole lot of arms. So obviously that's a joke. We were strategic and very lucky at the same time in the design of the trail. So we own most of the land in many segments. There are 7 distinct segments. And then the other parcels are off of farmland. So the easements were a large percentage of the trail length, but a small number of actual private land owners. And so most of these ours were horse farm owners. So they were hesitant at first of the trail, but once we got to the trail feasibility study and we could show them the alignment of the trail and the various fencing that would go up along there to keep their horses safe and keep our bikers and walkers safe, they were proponents of the trail. So I mean, really, that's the hardest part. The biggest nuance of any trail construction is trying to create that relationship with the private owners. I think you have to really tap into what would make them interested in a trail, what would turn them off about a trail, and drive that conversation as much as possible.
Okay. So I just had one comment from Emily. The Get Outdoors PA Tick Lyme disease rat cards are still available, both in English and Spanish versions. And you can request those rat cards by emailing prpsinfo@prps.org. I will drop that in the chat shortly. And then I have a question for Cheri regarding Walk with a Doc. Is there an upcoming or planned Walk with a Doc soon, in spring perhaps?
We are hoping for spring. We do have to see how COVID plays out and what our capabilities are going to be able to hold a large event. But we are hoping for spring.
And that info would be at the DCNR website?
Yeah, we would write through DCNR and probably our resources newsletter that Josh talked about with technology.
Great. And how would someone sign up for that resources newsletter if they're not already?
I think there's a link. Diane, can you help me out with that one?
So you can go onto DCNR's webpage and sign up to receive our resources newsletter that comes out every other week. And BRC also has a newsletter, an e-news that you can sign up for. And in both of those resources, we will promote and upcoming programs. Or if we are going to launch a big Walk with the Doc, we are hoping to be able to engage 100 doctors in the spring of 2021 and have walks at Jason's Park in East Goshen and walks at state parks and wherever we can hook up and connect health partners with and doctors with our recreation programmers and be able to have these walking events from one end of the state to the other. So we'll promote that in the BRC e-news as well as the DCNR resource.
Great. And Emily just dropped those subscribe links into the chat box for everyone. So if you open up your chat box, you'll see that link there to sign up for the resources newsletter and the other BRC newsletter that Diane mentioned.
Well, thank you, Emily.
All right. Well, I don't see anything else coming in through the chat. So thank you again to all of our speakers who were able to join us today for this 5th and final session of the State Comprehensive Outdoor Recreation Plan webinar series. I believe the plan is to make these links, these recording links, available at that DCNR Recreation Plan page as soon as possible. I'll be getting those files over to Josh shortly, so I'm not sure exactly what the time frame is on that, but it should be available soon for all 5 of the webinar series. And without further ado, I will let everyone get back to the rest of their day. Have a wonderful Tuesday, all.
Thank you.
Thank you. You too, everyone.